So we are starting the podium presentation. For this, for judges, we have Dr. Akingoria sir, Dr. Pradeep, and myself. So I first call upon Chandrakala, the PG student from AIMS Bhatinda. So you can start your presentation. Five to 7 minutes. It's up to 7.
Good afternoon, one and all. Did you know over 25% of the cases in which we practice in forensic medicine go unidentified due to lack of population specific data, and facial reconstruction plays a key role in aiding identification, which led me to choose this topic of titled Estimation of Facial Soft Tissue Thickness by 3D CT in North Indian population for craniofacial reconstruction. I did this study under the guidance of Dr. Agleesh Patak sir, who is professor and head of the Department of Forensic Medicine and Toxicology, AIMS Bhatinda. Today I am here to present about this topic. And starting with an quotation, who quoted by Italian scholar, your identity is like your shadow, not always visible and yet always present. Coming to the outline, these are all the subtopics I will be here to complete in this presentation. Coming to the introduction, identification of an unknown dead body plays a vital role in any medical legal investigation. Determining the identity of a person from skeletal remains is typically challenging, and anthropology serves as a fundamental and conventional approach to estimate age, gender, and ethnicity. But recent advancement methods for accurate identification include biometrics like fingerprinting, facial recognition, and DNA profiling, alongside advanced techniques such as digital signatures and behavioral analysis. In cases of decomposed or skeletonized remains, forensic anthropologists use as osteometry, craniofacial reconstruction, and forensic databases like Fortis. Techniques like isotopic analysis, radiocarbon dating, CT, and MRI provide further insights into identity and origins. Craniofacial reconstruction in forensic medicine creates facial representation from skull to aid in identification using 2D, 3D, and advanced AI-assisted techniques. Accurate reconstructions rely on measuring FSTT at specific landmarks considering factors like age, sex, and ancestry. FSTT measurements are obtained through direct methods like calibers and indirect techniques such as CT and MRI. CT scanning is particularly reliable for measuring FSTT. To the best of our knowledge, in India, FSTT data availability is limited to few regions and there is no specific data for the North Indian population, which this study aims to address for improved 3D facial reconstruction. The aim of my study is to estimate FSTT of North Indian population for craniofacial reconstruction, and the objectives include estimation of FSTT at various landmarks on face by 3D CT, and to correlate the FSTT data with age, sex, weight, height, and BMI, and to compare descriptive findings of North Indian population with other regional populations. These are all the review of literature, including in my study, in which various authors use various methods to estimate FSTT data. And coming to the materials and methods, my study sample includes 199 samples, and it is observational study conducted in the Department of Forensic Medicine and Toxicology in Spatinda, and it is approved from IEC. And informed consent was taken from every sample. And this is the formula I used in my study, and height and weight was recorded as shown in the image here, and BMI was calculated as per formula, weight in kg by meter square. Coming to the inclusion criteria, my participants of age 14 to 80 years coming to the age Patinda for city head and face were included for the present study. And exclusion criteria, participants with deformities of face and systemic diseases and with history of surgical procedures involving face of head are excluded, and who are not native of Punjab, mostly native of North Indian states are excluded. CT images were taken by Siemens Sumtam drive, which was shown in the image, and converted into 3D images in the workspace using Simbo.io software. And these are all the various landmarks on facial bone, which was selected and measured for calculating soft tissue thickness extending from outer bony surface to outer skin surface. And data was entered on an Excel sheet and statistical analysis done using SPIC version 20. These are all the 18 landmarks which I choose in my study, and representing all the landmarks here from where I am taking all the points. And this is how I am going to create when we receive a skeletal remains by applying my data. And coming to the results, this is the sex distribution of my study population, which includes 91 females and 109 males, and the mean age of males was 14 and 14 to 78 years, and females was 18 to 77 years. And coming to the brief in results, like I got mostly supraorbital region, infraorbital region, submesial and dacian landmarks in all the age groups. I found more spatial soft tissue data thickness in females compared to males. Whether except of all these, all the data includes male having most facial soft tissue thickness data more than females. Coming to the conclusion, FSCT is more in males than females except at specific landmarks. This is the conclusion I have already given. And overall, BMI was consistently higher in females across all age groups, and all parameters in males exhibited that is strong correlation with BMI, whereas in females, correlation with BMI were observed for all parameters except subnasal and chin lip fold. Importance of the study. The study established normative FSTP data for the North Indian population, revealing unique soft tissue characteristics compared to other ethnic groups. Using 3D CT scanning, precise measurements were obtained across facial landmarks, highlighting significant sex and age variations, with males generally having thicker tissue. Forensic applications, like we can use for forensic facial reconstruction, assists in identifying unknown individuals by recreating their facial features from skeletal remains, especially in cases where DNA records are unavailable for cross-matching. It helps generate leads by providing visual approximations that can be recognized by investigators or the public. Coming to the clinical applications of my study, it includes the FSCT database can also be utilized by surgeons and orthodontists to plan for facial reconstructive as well as aesthetic facial rejuvenation procedures with greater precision, considering population-specific soft tissue characteristics for better aesthetic and functional outcomes. It also encourages further FSTT research in other populations. For the scope of this study, the future of forensic facial reconstruction will involve AI, machine learning, 3D printing, and improved imaging techniques like augmented reality to enhance accuracy and realism. Expanding population-specific databases and conducting longitudinal studies on aging will improve precision across diverse groups. Integrating genetic data with anatomical analysis could lead to personalized reconstruction, and specialized software and labs can be developed to support these advancements in forensic and clinical fields. Like my take-home message was enhanced population-specific databases with accurate data on diverse groups can greatly enhance forensic facial reconstruction for the deceased and improve clinical applications for living patients, leading to better results in aesthetic and plastic surgeries with more precise and functional facial outcomes. These are my references. Thank you.
Because we usually come across the Vinda also I think we come across the skeleton body where a problem of printing issue is there. So we hope that we will be able to rectify those. सेट इंजन है हमारे पास चलो आप क्लॉक को लगा अपने वाला लगा लो
paper presentation.
So we have a next presentation again from the PG student of AIMS Bathinda, Dr. Teresa James. यहाँ से next करना. From this mouse you can do next.
A very good afternoon to one and all gathered here. Myself, Dr. Teresa James. I'm a second year postgraduate resident in the Department of Forensic Medicine and Toxicology in AIMS Bathinda. So today I'll be presenting a paper titled Questioning the Safety of Children at Home Following Recent Cases of Child Abuse. So this is an overview of what we'll be dealing with today. So before we begin, let us all take a moment to ponder upon what's the most cherished memory that you have about your childhood. Okay, so in my case, one of my favorite memory is the conversations I used to have on my way back home from school with my brother. And now I realize that it was a huge blessing, and you will know why in the subsequent slides. So coming to introduction. Child abuse is a global health problem affecting millions of children, irrespective of the race, age, and the socioeconomic status. And World Health Organization defines child abuse as all cases of physical and emotional maltreatment